What makes a medical practice successful? Patient-centered care. I cannot emphasize this enough. So if you have your own medical practice, whatever type it might be, telemed, IV hydration, aesthetics, primary care, if you give patients what they want, you are extremely accommodating, extremely good at listening, understanding their needs and meeting their needs, you're going to have raving fans as clients, as patients. They're going to come back to you and they're going to tell other people about you and refer to you. So I have a couple stories. One is I collaborate with a physician assistant in North Carolina who just started his practice a few months ago. When we had our monthly meeting video check-in last month, I asked how business was, how busy was he? He said, we are more busy than I can even believe. And it's amazing. As a new practice, how did that happen? So I kind of pushed him on it. Like, what is the key to your success? He's a very humble guy, so this probably wasn't his direct quote, but he said he treats everyone who walks in his door as if they're family. And that is the key to success. He's actually not running ads, doing other marketing. He said it's literally word of mouth. So he had a few people come in, he treated them like family, and now they're bringing their own friends and family in. Unbelievable, but true. So this is a real life physician assistant making his practice work this way. So I think that's incredibly powerful. My other anecdote, I used to be the medical director of a very large federally qualified health center in Washington, D.C. We had, I think, about 30 providers. More than half were nurse practitioners and the rest were physicians. So I was sort of the boss, in charge of everybody there. And it was interesting to see who had a full schedule and who did not. And some people's panels got closed because they were so busy, and other people's panels were always open to allow new patients to come. And what was the difference? It was the providers who provided excellent patient-centered care. I'm not saying you don't also do clinically centered care, like the correct thing with evidence-based medicine. It's a juggle. You have to do both. But you're really nice and friendly and approachable and warm, and you remember they have a dog that they love or their mother died last month. These are the things you keep track of and you mention at visits, and it makes people really, really like you and want to come back to you. So does it take a little more time and a little more memory or a little more note-taking to remember these things? Definitely, but it's 100% worth it. So I challenge you, be the most patient-centered provider you can possibly be, and that will be better than paid marketing. It will bring you new patients, more than hopefully you can handle, like the collaborator I'm helping, and it's going to be very exciting. All right, have a great day.